advanced techniques and equipments being introduced in cardiac wing?
New Cath Lab has a lot of advanced features, and this machine has advanced qualities so it can do a better job of vascular work as well. By bringing this machine here, we intend to really benefit the patient.
Are there any preventive care cardiac wings?
Diet, takes the medicines on time, takes care of his general routine in a manner where he does not require hospitalization. 50% of the work we do is Aarogyashri. That means patients don't. We use the same medicines for Aarogyashri patients that we use for cash patients. This happens nowhere. It is impossible.
Can you share a decision you made significantly change the hospital's direction and what you learned from it?
One decision which we had planned in the very beginning, doing whatever we can for the patient. That was one big decision from the beginning. And that has moved us and given us direction. Convenience is a human habit. If you are not concentrating towards what actually needs to be concentrated upon, it becomes very difficult.
It is my privilege to introduce the chairman and managing director of Olive Hospitals, a visionary leader whose dedication to excellence in healthcare has guided the institution to remarkable success. Under their leadership, Olive Hospitals continues to set high standards in patient care and innovation. Please join me in welcoming them. What advanced techniques and equipments being introduced in cardiac wing, sir?
Yeah. The new Cath Lab has a lot of advanced features, and one of the main things is the quality of the image. In the Cath Lab, you need to see the artery very clearly to determine the size of the stent and where it has to be placed. This new technology offers that. Secondly, the amount of dye required for that image. By giving less dye, we can get that quality of image. This is helpful specifically in cases which have kidney problems, and the dye acts to the detriment of the kidney. So even for kidney patients, this procedure becomes simple. Further, this machine has the ability to do neuro interventions also. A lot of neuro interventions have developed during this period of time, and this machine is capable of doing that as well. Apart from that, what we call the vascular work. A lot of arteries in the hands and the feet are at times blocked the same way as the heart vessels are blocked. This machine has advanced qualities so it can do a better job of vascular work as well. And by bringing this machine here, we intend to really benefit the patients in a very, very useful and health conscious and with minimum kind of side effects in the procedure.
How will this wing enhance the patient experience and as well as reducing treatment time in health conditions?
Treatment time, because this procedure depends upon, there's not one single procedure. Some procedures are very simple, some procedures are very complicated. For example, now interventional cardiac work includes work of placing valves in the heart, which earlier required surgery, right? Closing of holes in the heart, again required surgery. This is now being done at the Cath Lab level. So there are a lot of work which are being done, and if you are doing it in the Cath Lab, obviously the stay becomes very small because you are not cutting, there is no cutting injury. So that gives a lot of, and the risk factor also gets reduced. So considering all this, there is going to be an impact, but again, as I told you, it's a very, very technical area. It depends, but this machine does really help in the quality of work and reduces the time of stay in the hospital as well.
Are there any preventive care or planned for this cardiac wing, sir?
Preventive care is a regular feature of any hospital. Hospitals, first and foremost, want to do the preventive part, because if the preventive part is not there, the kind of patients we would be getting would be so high, and it would be totally unethical not to guide patients towards their own health and see to it that they don't come to the hospital and get admitted. That is the first role of the hospital, to see to it that the treatment as much as is possible is done at the outpatient level. One, from the point of view of being more simple. Secondly, from the point of view of it being very, very low cost. So if we can keep the patients at that level and treat them, that would be the best thing for the patient. And Olive has always been patient-centric. What is good for the patient is good for Olive. It is not the other way around. What is good for Olive is not good for the patient. It is only from the patient that we have to look, not from our end. We shouldn't have an angle at all. We should have only one angle, the patient's betterment. So in that, treating the patient at the outpatient level, right, seeing to it that he maintains his diet, takes the medicines on time, and takes care of his general routine in a manner where he does not require hospitalization. This is our first purpose. Second is the inpatient part. There we want those who, despite of all this, due to age or maybe genetic factors or lack of care, can at times come in the emergency and they need to get treated immediately, and that is the second part. But the first part is the real part. 95% of patients or even more who come to us come for the outpatient work. About 5% or less are admitted.
What kind of specialists are professionals to be part in this cardiac unit?
See, we have a very good team of cardiologists who are with us from last so many years. They are also well equipped with the earlier Cath Lab what we were having it, and there's a new version. I am sure the team, they are going to take the full advantage of this new machinery, wherein the clarity is so good. It is going to benefit to the patient only. And the doctors, with the consultation of them only, we have thought of going for this one. And I am sure patients are going to be much benefited compared to our earlier cath machine.
Will the hospital collaborate with any national or international experts?
Normally, we definitely welcome that. Whenever we get the opportunity of some international doctors, when they come to us, we'll try to take the advantage of that. We'll also discuss with our cardiac team so that if there is any improvement which is needed, so it has to be implemented as well in India and Olive also.
We have actually done we have done an international conference on cardiothoracic surgery a few years ago, where we had a very famous heart surgeon from Melbourne, Australia. And in that conference, we had doctors traveling from all over India as well as from Dubai, Sri Lanka and other places. And that we conducted here in Hyderabad at our hospital. So we do really have. Second, we have done a 3-day conference on teaching medicine. How is medicine to be taught? In universities, medicine is taught, but how to teach medicine is not taught. So this specialty is very different. So we had a faculty coming from the University of Edinburgh, England, and they did a 3-day conference at Olive. So we are trying to promote international ideas by holding conferences, international conferences in our own hospital. And these 2 conferences which we have held here have been really useful for all the medical colleges of Telangana and Andhra Pradesh, because the participants had all come here to learn how to teach medicine, irrespective of whether it's general medicine, general surgery, general medicine, how medicine is to be taught. That we have done here with the help of this international conference and the faculty coming from Edinburgh, UK.
How will this new wing care about affordable prices for patients?
I think just now, we have discussed the price is not going to matter much, and I'm sure that the patients who are using earlier cath, they will also have the same cost even for the new machines. We don't have any plan of going to increase the price in that. Only they are going to be much benefited because of the quality.
First, the thing is that 50% of the work we do is Arogyashri.
Therapist.
Right? That means that the patients don't pay. Second, we use the same medicines for Arogyashri patients that we use for cash patients. This happens nowhere. This happens nowhere. It is impossible. Because we can use very cheap medicines which are having the right to be sold because they have a registration with the government. But we don't do that. We take the best medicine which we give to a patient who pays twice the amount or even more, and give the same medicine to the Arogyashri patient. And we have Arogyashri since 14 years now. So during these 14 years, I think we have spent crores of rupees extra for the sake of the poor patients, both at the level of cardiology, intervention, as well as in what we call heart surgery. We use the same medicines, same sutures, same machines, same ventilators, same food. Nobody gives same food. We give the same food which we give to a single room patient to a Arogyasri patient. This is the specialty of Olive Hospital, and we do it for the sake of helping the poor as much as possible from the hospital.
What impact do you expect from patients over here?
Olive actually is a super specialty, multi-specialty hospital. We have full-time consultants in all branches: cardiology, neurology, neurosurgery, nephrology, pulmonology, critical care, emergency medicine, and general surgery, orthopedics. All of these departments, gynecology and obstetrics, have full-time doctors and surgeons. Cardiology is basically more focused because the heart gives you very little time, and the treatment can reverse the disease immediately. For example, if a person has a heart attack and he comes here, if the stenting is done within the first 2-3 hours, his heart muscle is not damaged. That is the benefit. Which it becomes as if he had not had any problem, no heart attack at all. So this significance is there, and therefore we feel that cardiology generally leads in the corporate hospital field, because the thing it is able to deliver is immediate. And once the stent is put, you can see the blood which was not flowing flow immediately.
Okay.
So the patient will feel the change immediately without any surgery. So one of the wonders of modern medicine and technology is this procedure. Without cutting, without doing anything, the patient is not even given anesthesia or anything. Within minutes, he comes back to normal. She comes back to normal. So this one advantage gives and obviously we know heart diseases are the biggest killers in the world. So if we can take care of the heart in quick time, it really helps us to benefit the patients in other areas also. Because the heart patient is not necessarily will only have heart problems. He could have so many other problems. If you have super specialties in other areas, this coupled with that, a heart patient could have nephrology problems, kidneys could be malfunction. It could be having pulmonology problems because the heart is not working properly, it impacts the lungs.
Exactly.
So all this put together, when we give a complete treatment, that helps the patient. It is multidisciplinary and super specialist level treatment, along with the support which we give at the level of the heart with top level technology.
Actually, I have small doubt on this, sir. Actually, which one is suitable and which one is best for cardiac patients? Open heart surgery or this one is?
There is a very clear correct protocol on this. Certain areas are totally not to be taken towards surgery at all. Right? This forms about 80 to 90% because the Cath machines have become more advanced and a lot of work can be done on the Cath machine itself. Okay. The remainder, there could be one gray area where there is a chance of going towards cardiothoracic surgery, open heart surgery, or not going. In that area, it depends on the patient also. There are some patients who like to prefer stents. Some will say, no, it's easy for us if we go through the surgery and then we don't have any problem for a longer period of time. But there are certain cases where no cardiologist will touch in a Cath Lab. Right. There, they will be very, very clear that you have to go for CT surgery. The main idea is CT surgery is cardiothoracic, open heart surgery, which you are saying, or CABG.
If Olive hospitals could solve one major healthcare problems and in the next decade, what would you want to be and why?
One of the biggest problems of healthcare is not to do directly with healthcare. One of the biggest problems, you will be surprised. The biggest problem is the advent of money in healthcare. You know the impact of money in politics? You know it, right? Similarly, what has it done? It has done better or it has done worse. For the public, the involvement of money in politics has made politics a very dirty game. Similarly, healthcare is slowly moving towards and gravitating towards that. Money is playing a bigger part than technology also. And because when money comes, I was telling in the press conference upstairs that a relationship between a husband and wife, if purity is there, it works differently. If money comes in between, what happens? Does the relation becomes better or worse? It becomes worse. In healthcare also, between the patient and the doctor, money should be secondary. Money is required. No family lives without money.
Exactly.
But it doesn't come in the middle of the relationship. That is what we want to do. And the biggest problem which is going to come is the monetization of healthcare. More and more. We were coming from a socialist system, right? All healthcare was taken care by government.
Exactly.
Right? Even at that time, when a chief minister used to have a heart attack, he would land up at Osmania in the 70s and early 80s. That was the central hospital at that time. Today, it's not like that. So as things move forward, we find that the ordinary man is getting lesser quality care compared to the better off. And the better off are not more than 20%. 80% are getting substandard care because it has become too expensive, and where it is not expensive, the quality is not there. Olive wants to do that. We have a very clear policy. There is a saying, right? Atiti Deva Bhava.
Nothing there.
Right? And we have another saying, Vasudhaiva Kutumbakam. Right? Take these two. A patient comes to a hospital. Should he not be treated like a Atithi? Not in a good circumstance. He is not a smiling Atithi. He is a Atithi who is begging for support. He is willing to pay also. But his money directly cannot give him health. It has to go through the channel of treatment of the doctor and the support system. So when he comes here, we should treat him as a Atithi in need. Somebody knocks at your door. Right? He's a sadhu. He's asking for food. And you have good food. And you don't give him good food. You give him food which you are planning to throw away. What will people call you? You will say you have not respected the person. You should have given something better than what you eat, than what you gave, which you are supposed to throw after a few hours. Here also in healthcare, it comes like happening. Can you give your best to every patient who comes in? With that Atiti Deva Bhava idea, which is so much an Indian ideal, and with the idea of mankind is one family, Vasudhaiva Kutumbakam. If these two are brought into healthcare, healthcare would be very different. And the 80% who are not getting it will start getting it. So the greatest problem which is going to come, and it is already there, the onset is there, it will become worse as things go forward. I think by introducing these things and living with these things for the last 15, 16 years from the day we started, I think we have done a very good service. And we want to expand and do more. We have one hospital already. We are planning another. So we want to set smaller hospitals around us so that we would be able to give better service to people all around us. And if they really require something, they can come for tertiary care, higher end care to Olive, the present Olive you're sitting in.
Okay. How do you balance cutting edge technique impact with touching in patient care?
As I just talked, our doctors have been told, they are very clear, that the patient is not someone who needs, we have our policy of charging the patient, right? That policy is intact. The doctor doesn't think about the patient from the money angle. He will tell this is the thing, this is the price, compared to any other place. We don't have anything of a kind where we overcharge the patient. We are known to undercharge because, again, as I told you, if you have that Atiti Bhav, you give the best. And the giving the best is just not about quality of healthcare through good technology. It is of the money aspect as well. You will not charge him more than what is required. So that idea of Shubh Labh, again a very Indian idea. Shubh Labh also comes in. You are not sitting in the healthcare to profit. You have to serve and serve at a charge. You are not a charitable hospital. And people coming here also come with the idea that it's a corporate hospital. But that doesn't mean that you will overcharge the patient. So what we do is we keep our numbers in a manner that our numbers cover up for the cost which we are giving at a reduced level. If I have 10 patients, I will have to charge X. If I have 20, I can charge X minus 5%. We are trying to move into that direction, where the numbers compensate for the reduction in price. That is the policy of Olive from the very beginning, and we hold on to that. And that is how we think we are working with bringing high-end technology with a good heart.
Can you share a decision you made significantly change the hospital's direction and what you learned from it?
One again, as I told you, one decision which we had planned in the very beginning. Again, that decision goes back to doing whatever we can for the patient. That was one big decision from the beginning. And that has moved us and given us direction. If the patient is the center of the activity, right? If you move the center, you become what we call in English is eccentric.
Excellent.
That is, your mind is not working proper because you are moving the center. Concentric is where the center is one, and then the circle needs to get wider and wider. We don't change that. So what we have done in the beginning is this decision that the center is the patient. Whatever revenue and whatever work we are going to do will all go around the patient. When we started, the revenues were much lesser. Today our revenues are much more, but the center has not changed. The circle has become bigger.
Yeah.
The pie has become bigger. Generally what happens is convenience is a human habit. If you are not concentrating towards what actually needs to be concentrated upon, becomes very difficult. It becomes very difficult. I'll give you another example from the Mahabharata. When Drona asked all of his Shishyas to hit a bird in the tree, and this all started aiming at her. He asked one question, what do you see? They said, we see this, that, we see you and all that. He didn't make them shoot. And then he finally goes to Arjuna and says, Arjuna, what do you see? He says, I only see the eye of the bird. He says, then shoot. And it hits the eye, right? What we call the bullseye now in shooting. So if you have that focus, then only you will hit in the right direction, move in the right direction. That was one decision which we took before starting. We will not compromise on the centrality of the patient. The patient should be in the center. And we are very proud that we have not moved out of that. We have not become eccentric.
In what ways Olive Hospital preparing for future crisis for unchallenged?
Future crisis can come in a different way. Sometimes there are mass casualties. Big road accidents are happening these days. 15, 20 people at one time are coming. Our facilities are not of that kind which can handle mass casualties. It's a very separate kind of a thing. Last year, we did a conference in Iraq where we got the WHO people to teach people there, because it's a war-torn area, how to handle mass casualties. We have the same expertise here. At one time, we got a big accident had taken place near Moinabad, and we got maybe more than 11 patients put into a DCM and brought here. Right? We were able to save a lot of lives because we had that facility available. All our doctors, and that was in the middle of the night, all of them came. Nearly 7 of the patients, I suppose, had to be ventilated. Right? So minimum death, mortality occurred because we were prepared for that. Because this is a special area. How to handle mass casualty. So this area is going to become more and more because speed of traffic is becoming more, and therefore casualties are coming more and more. Injuries are there. Recently, we did an injury which was on the shoulder, and the pulse in the right hand had gone. Pulse in the right hand had gone. Patient was 22-year-old. Pulse is going in, your hand will not work, it has to be cut. No more blood is going there. It took a 9-hour surgery from 12 in the night till 9 in the morning to save that hand. One vascular surgeon, one general surgeon, and one orthopedic surgeon. The bone had also broken. All put together, we saved that patient's hand. From age of 22, he will be able to use his right hand, which was his working hand, all through his life. Otherwise, maybe an hour or two of delay, it would have finished. So these are the areas which we are trying to hone more and more so that we can give all of it centers around the patient. How we did it, all this work for maybe 4 lakhs. The doctor's charges were something close to 1.5. Medicines and all that moved us to about 2.5. Any other place, it would have cost not less than 10 lakhs. So doing this great job at a price which, and these people are middle class people or lower middle class people. We have to take care of them. And if we don't take care of them, who will take? This kind of facilities are generally not available in government hospitals. People will not rush to do that. And he is nobody's nobody. So nobody is going to move for him. No minister will call for him. Nobody is going to, MLA will come and see. So what happens generally is they get neglected. And once one arm is lost, his ability to earn his livelihood goes away. So these are the small things which we do, which we are very, very, very happy about.
Is there support for after surgery, patient recovery after? Example is diet or else anything?
Yeah, thank you. We have a dietetics department headed by a qualified dietitian who has an MSc in dietetics and specializing in patient diet. You will be very surprised. Diet plays such a role. A patient in the ICU, given the wrong diet, has chances of dying. Because digestion becomes very, very compromised in critical patients. If you give them anything which they can't tolerate, their digestion will pressure them and their heart in a manner that it will collapse. At times you hear that people, after coming back from parties, right, overeating, they die of heart attack. The reason is when they eat more, lot of blood is required for digesting it. So now when a lot of blood goes for the digestion part, very little remains for the heart to really use. So the pressure on the heart increases, that leads to a heart attack. So diet, this is for a normal person. For a person who is in the ICU, you have to really plan. And our medical director is an expert in this. Dr. Bansal, who is our medical director, he is a DM in pulmonology and critical care from PGI Chandigarh, one of the foremost institutes of teaching medicine in India, in Chandigarh. So you have to really concentrate on that. And for that, we have a separate department, complete, which takes care of this. And a lot of people also don't know. You might have never heard that diet could be so critical in healthcare, managing healthcare. This is the importance of diet. Secondly, doing this after the patient goes back home as well. So we actually develop recipes for them to control their sugars, their blood pressures. All of this is planned. And we have printed books for this purpose. We have written books for this purpose. So as I told you, one good decision moves everything. Put the patient in the center. Do whatever you can for him. It is like, as I told you, Atiti Devo Bhava. We make him Pujya. We make him Pujya. We really worship the patient for the sake of providing. The doctor is the Pujari. You get that?
Exactly.
He is Pujya or she is Pujya and the doctor is the Pujari.
Will there any awareness programs in the public?
We do a lot of camps, which is a regular feature. Our doctors go around here, our cardiologists go, our other specialists go all around, even to districts. We cover up Tandur, areas around that.
Yes.
And the reason is, it is the best thing that if a doctor can come closer to the patient. If one doctor can go to a particular area which is underserved, to get that kind of service, maybe 50 patients will have to travel to Hyderabad. So he travels alone, travels for 1 hour, 1.5 hours. So our people are going to Zahirabad, our people are going to Tandur and other places as well. And that benefits a lot of patients because they travel time, they'll have to leave their work and come for one whole day. He goes once in a week or once in a fortnight and covers them up. So the costs of the patients are also saved and they get the same kind of advice which they would have got if they had come to Hyderabad. But they would have spent a lot of money on travel, time on travel, miss their work. So all this again, one single question thing. Once you introduce that idea of patient, you do everything you can possibly as a hospital.
What are the facilities for emergency heart attacks?
As I told you, I mentioned also, we actually run a fellowship program in emergency care. That means we train doctors in the emergency. So we have at times 8 doctors who are being trained. So there are the emergency doctors already. With them at one time you have 2 to 3 trainees who are being trained under that. So we actually have a whole faculty in a sense which is trying to teach new MBBS doctors, which is a 1-year fellowship given by a university from England, and they write that exam after 1 year at our place. So we teach them also. So when you do all this activity, it helps in raising the standard of the emergency care. And as I told you, a lot of people come to us with pain in the chest. A lot of people. The fear of dying, because you hear so much in the news that somebody was going to a gym, he died while working on a particular equipment, mostly on a treadmill. Yeah,
treadmill.
I don't use it, so I don't get it in my mind. Right? So these kind of fears are there. There could be so many reasons for chest pain. One of the great things which we do again at this level is we try to find the cause. You see, do the ECG, then there is a basic test. We call it TROP-T, where the blood test tells you whether heart attack is coming or not, because a particular kind of enzyme comes out of the heart when the heart attack is coming. Once we are sure it is not there, we send the patient back. As I told you, we want him to be at home better than in hospital if it is not required. So a lot of patients, we had once a patient coming during 1 month, 3 times to our hospital, I have a heart attack. 3 times we sent him back. You are not having heart attack. Because there is no reason. That creates a lot of income for me. Then but I can't, then I move from that centrality of the patient. So I get money, but I become eccentric. I don't want to become eccentric. Or next stage after eccentric is madness. So I don't want to get mad after that. A lot of people have a lot of money, do mad things. You've seen that, right? You're reporters. You see in the news. Why do they do it? First, they don't think straight. They become eccentric. And then they become, the next stage is madness. So we don't want to take a hospital from its centrality of considering the patient to be the center and treat him in a way which will move our center away. And if that happens, we will in the long run destroy ourselves. In the short run, we will harm the patient. So we don't want to do something short run in the long run, which is going to be a harm for us. Logical?
Yes.
Thank you.
Do you have regularly heart checkups?
Yeah, it's a country. Yeah,
It's a normal practice. It's a common practice everywhere, Nathan.
Yeah.
Even with us also in our hospital, whenever the patient comes, if he has some small pain or something, definitely we'll go for the complete test. And we do regular.
We have a package, cardiac package, in which you have to do the what we call the 2D echo, then the treadmill test, right? So all these tests are done, and we have the quality equipment and specific equipment for doing 2D echo. Very expensive machines these days. You can get a 2D echo machine for 10 lakhs. You can get it for 50 lakhs or even more. We have to put it a lot of money. We took it about 6 months ago, I suppose. Yeah? 4 months ago. A new machine, right, costing something like 55 lakhs. And just for the sake of it, we can do it on a 10 lakh. Nobody knows the cost. But as I told you again and again and again and again, whatever we can do for the patient has to be done, even if the patient doesn't know. And I told you of medicines. We don't tell our Arogya patients that we are giving you the same medicine which we are giving to the single person. He also doesn't know. He comes, gets it done and goes away. But we do it for the sake, as I told you, we don't tell the patient, this is a 55 lakh machine, right? Others do it at 10 lakh machine. Why are you should be we don't use it as a selling thing. We use it as a kind of Shraddha, Bhakti towards the patient, something which I suppose is not there today in a lot of places, but the majority of places. We as humans were created to love. Don't we have Shraddha to our parents? Right? We have some kind of feeling of there being something great for us.
Yes.
Why can't it be extended
Patient.
in some form or the other to others? They are also parents. People who count, most of them are aged. Right?
Thanks.
Why can't it be extended? Can it or can it not? It can, right? But why doesn't it happen? Because the intention to do it is not there. If you have the intention, and God has given a good intention in all of us, had that good intention not been, we wouldn't have Shraddha towards our parents, love towards our children. What we call Mamta is a God-given quality. What I'm telling of Shraddha to the parents is a God-given quality. How do you say that God has limited to the children or the parents? Does not the teacher treat at times her students like her, as if they were the children?
Yeah.
And the quality of the teacher would be so different. All of us remember, maybe in our childhood, we did get teachers of the kind who were loving us like mothers. If they could extend it from their children to other people's children, why can't we extend it, that kind of Shraddha or that kind of Mamta, to the patients who are coming to us? I feel it's possible, and we are working towards that direction, where that is enhanced. The more it is enhanced, the quality will become different and the patient's recovery will be different. Because if you see a person taking really care of you, your recovery becomes different. And if you find apathy just being done for the sake of money, you will feel that people here are only interested in getting as much as possible from you for the sake of money, not for yourself. That will again put the pressure on the patient's mind and the family. We want to reduce that to this as much as possible, even to a zero if possible, and we have tried that and we are trying that.
Do you accept any other insurance other than Arogyasri?
Yeah, we have all the insurances. We have all the insurances, coverage, right? And we do it. And similarly, another thing, when a person comes with insurance, the effort is to make the policy, if he has a 5 lakh worth policy, exhaust as much as is possible. We don't do that. Because of that one central principle I am saying, it is the patient's requirement which should determine a test, not that he has a 5 lakh cover, why not I cover up to 5 lakh? Because anyways, he has a cover or she has a cover. That greed again moves the center away. We don't want to do that. And we are surviving on that without making the patient in insurance pay more, because he's not paying it out of his own pocket. But what happens at times, next time he's sick, that whole thing has been exhausted, he'll have to pay from his pocket.
Okay.
We don't want that. So we do treatment what is good for the patient, irrespective he has a 5 lakh policy or a 10 lakh policy. What he requires is done maybe for 2 lakhs or maybe less.
What are the suggestions to give that cardiac patients mainly?
There's so much information on that. One thing is our daily habits. Most of the cardiac work which is happening, specifically among young people, is because of sedentary lifestyle and diet.
Right.
Doctors are here. I'm not the person to tell that. I was already quoting you, doctor. Right? If you want, you can ask in detail and more comprehensively if you want to Dr. Bansal. He is here. But the main things which I have heard from them is sedentary lifestyle and high fat diet or sweets. All these things are impacting the general health of the people. Plus, one more factor which I was mentioning, stress,
Exactly.
stress levels.
How this cardiology being different from other hospitals? What is the specialties?
See, there are a lot of cardiac institutes here. A lot of them have been before us. They are really working hard, and everybody works with a good machine. And there is, what I feel is, there are so many patients and there are so many hospitals. Quality is there in the top level hospitals, right? And it should be there. We also have the same quality with the fact that we are price conscious, which is very important for 80% of the population. right? Maybe 20% is covered through Arogyashri, and maybe about 10 to 15% through insurance, and the rest, about 40% plus, are those who pay from their pockets. So what we actually feel is, and then the question of doing that for the patient which the patient requires, right? Minimizing his spending on treatment, not over treating nor under treating. So when you come to all this, it comes to a question of decision making by the doctors and the system, the way it is done. So because we don't give targets to doctors or any other kind of pressure, they work only for the patient with the kind of technology available. So to work only for the patient without any stress, that is the real big thing which has to be taken care of.
Some of the technology is open to every hospital, to every doctor. One can use the technology. Then added to that, the doctors who are going to use the technology, how much they are expertise. That also plays a role. So just because you have a good cath lab, it doesn't mean that the doctors can perform good. Even the doctors has to be experienced one who can able to take decision when it comes to sometimes the patient goes to some different direction. If the doctor is capable of doing properly, he will take care all this factor. So that way, not only the technology, but also doctors' role plays a very, very vital role.
And last one question, sir. Can you give any suggestion for middle class or else poor people? Because hospital is very high, their prices are, maybe they thought that. Can you give any suggestion for?
I told you in the beginning, Arogyashri is there. Apart from that, what we try to do is, we have general ward in which we have priced very low for patients who can't afford rooms or even sharing. What that does is, they will have to be paying mainly for their medicines and their investigations. Even in medicines, our doctors are there who would like to see to it that they get good medicine without the really high priced ones. So bringing down the cost of treatment is one of the ideas for specifically those people who have budget constraints and are not covered by Arogyashri or insurance. So these are the ways we actually move forward. Place them in the general ward, give them the same food, give them every facility which is there, charge less at the ward level, and give medicines which are quality medicines but are the less expensive one. So they are higher expensive things also, but that can be afforded by fewer people. So we take care of that as well, that what they require is given without compromising their treatment. Then again, it's a question of helping everybody.
Exactly.
The idea should be like of a tree, right? It gives shade to everybody, right? The poor comes or the rich comes. The hospital should conceive itself, think about itself as a tree which should be giving shelter to everybody, right? To the birds, to the human beings, right? And at times, fruit also.
Thank you so much for giving suggestions and about new wing. And thank you so much.